We are now going to test your knowledge of somatic disorders by looking at some cases. So, 43-year-old man comes to the ER with a possible stroke. He has no history of medical problems, but says, I know my blood pressure was up because I just been arguing with my wife. I stormed out of the house, but when I tried to open my car door, my right arm just would not move. You see his exam with vital signs. On the neurologic exam, his cranial nerves are intact. He's got upper extremity strength 5 out of 5 on the left, but 0 out of 5 on the right. His reflexes are symmetric throughout. His motor tone and sensation are also normal. He has no abnormalities on his gait. Which of the following diagnoses is most likely in this patient? So you have to realize that if he really has flaccid paralysis on the left from a stroke, we would expect hyperreflexia. Indeed, he doesn't make neurologic sense, and so we call it a conversion disorder because he has a pseudo-neurologic symptom. Okay, 36-year-old woman with 3-month history of poor energy concentration, sleep appetite, and difficulty enjoying activities. She also has headaches, abdominal pain, and decreased interest in sex. Physical exam and labs are normal. You think she may be depressed, but she denies feeling depressed. She would feel much better if she had more energy and was sleeping and eating better. What's the most likely diagnosis? And the answer is major depressive disorder. Note, you don't have to have depressed mood to have major depressive disorder. She just has here difficulty enjoying most activities, or anhedonia, and that's one of the two cardinal symptoms required for a diagnosis of depression. The other teaching point is many people with depression also have physical complaints, and if the physical complaints are in the setting of a mood disorder, we call it the mood disorder and not a somatic symptom disorder. A 54-year-old nurse presents to his primary care doc with intermittent blurry vision. He's had about 2 episodes over the last 2 years, 2 episodes per week, each lasting a few minutes. There's no headache, nausea, vertigo, or focal deficits. No recent change in frequency or duration. He's had all kinds of evaluations, but there's no evidence of disease. But he's convinced there's something wrong. He thinks he has a brain tumor and that his physicians have been lying when they've told him that his brain scans are normal. He wants the doctor to order a brain MRI. Most likely diagnosis is delusional disorder because he's convinced he has a problem that the experts say he doesn't. Fixed false belief. Okay, 28-year-old Army sergeant visits an ER because he's got intense burning pain in the epigastric region. He was eating dinner. When he felt nauseated, he ran to the men's room and vomited bright red blood. He had a similar episode on 2 previous occasions in the past 2 years. He was told it was serious. He's unable to elaborate further. He says he's been under stress in his marriage, but enjoys being an Army medic. When seen by the nursing staff, he is alert and awake, and you've got his blood pressure and pulse. Note there's no orthostasis. When the physician enters a patient grimacing with the hand over his left upper quadrant, he winces upon abdominal palpation. Bowel sounds are present everywhere. His stool Wyatt is negative. Physician describes her findings and tells the patient that the gastroenterologist is on his way from home and should arrive in about 45 minutes. Patient becomes irate, demanding to be discharged unless an NG tube is immediately placed. Which are the following diagnoses? Factitious disorder, because we don't see any objective evidence of a GI bleed, and yet he wants to have an intervention as soon as possible. So he has factitious disorder. And here's a bunch of matching questions that you should take a look on your own.